Have you wondered if being a highly sensitive person might increase your risk of high risk HPV and abnormal PAP smears? I'm Dr. Donnie Wilson, and I'm a naturopathic doctor and women's health expert. I help women who are testing positive for high risk HPV virus and potentially have abnormal cells on the cervix or in the vagina, and they're wanting to reverse that to eliminate high risk HPV so they don't have to continue to get ongoing procedures and potentially develop cancer. So, the thing is that most women find out that they're testing positive for high risk HPV when they go in for an exam with the gynecologist. And they might be getting a PAP smear, and now more and more practitioners are doing a high risk HPV test at that time. And that's when women are finding out that they're testing positive and going into shock, thinking, how did this happen? Where did this come from? Other women might have been testing positive for more than 5 years and feeling frustrated that they're not able to get it to go away. Either scenario can lead to many different procedures, including biopsies, LEEP procedures, even surgeries to remove abnormal cells. And yet, those procedures do not kill the virus. And so women can get into a loop of needing repeated procedures for recurrent abnormal cells because the virus is not being handled. As a women's health expert specializing in high-risk HPV, I've been helping women, thousands of women from around the world for over 25 years. And so I've seen the patterns, I've read the research, I've identified a protocol to help those women. And that's why I'm so passionate about sharing that here with you. So if you're dealing with high-risk HPV and trying to find a solution, then I welcome you to contact me in my office so that we can help you. So one pattern that I've observed with high-risk HPV and women who are struggling with it is one that they often report having experienced a high level of stress in the past 2 years. And because I specialize also in stress, I explain to them that stress lowers our immune function and makes us more susceptible to infections, including high-risk HPV virus. But those women are not just experiencing regular stress, they're often also experiencing trauma. Trauma, whether it was prior in their life, even back to childhood, or trauma in their current life, in perhaps toxic relationships, romantic relationships, or work relationships, or other issues and crises in their life that is creating trauma. That trauma affects our ability to have a healthy stress response, and again, throws off our cortisol levels, throws off our immune system, throws off our microbiome, and makes us more susceptible to abnormal cells caused by HPV. Now, how does this fit with being a highly sensitive person? Now, highly sensitive person is a concept that was developed to help understand those of us who are more sensitive in our environment. It means being more sensitive emotionally, more sensitive to others, and from others, being more likely impacted by other people in your life, as well as more sensitive to chemicals in your environment, more sensitive to substances that you may take in, more sensitive to foods, more sensitive even to nutrients and herbs. And sometimes, as a person who identifies as more sensitive, it can feel like you're just more sensitive to everything, including EMFs and travel and weather changes and everything. In fact, you can feel like you're trapped in a corner because you feel like every which way you turn, every which thing you try to do, you feel worse because your body is so sensitive to everything you're exposed to. And I can understand because I identified as a highly sensitive person for many years of my life. It took me a long time to navigate and figure out how to help myself heal so that I am less of a highly sensitive person. But I completely understand that experience because I've been there. I was a person who was getting severe migraines for many years, over 2 decades. And those migraines were triggered by foods, by substance, herbs even, by travel, by weather, by chemicals, by stress in my life. Every time I was exposed to too much of anything, I would end up with a migraine that would cause me to have vomiting, that would cause me to be able to not do anything for several days. So it's a real deterrent. It can cause you to feel like, oh my gosh, I'm afraid to what can I eat? What can I take? What can I do? Because if I do, then I'm going to feel worse. Sometimes it's fatigue, sometimes it's joint pain, sometimes it's headaches like me. Sometimes it's skin rashes, sometimes it's irritability, anxiety. Any of these symptoms can happen when you're especially sensitive to your environment. And what's known about someone who's more highly sensitive is also they're very much more prone to burnout, what we call burnout, which means that the stress overwhelms the system, right? And I would say the stress causes us to be more sensitive, and then more stress on top of it, of course, makes us feel even worse. So stress perpetuates the symptomology of being a highly sensitive person. And so this all can set you up for a higher risk of infections, including high risk HPV virus. As well as, if you think about it, someone who's highly sensitive is going to be, and this is very common for women in general, really more likely to pay attention to everyone else. Pay attention to, how does this other person feel? What can I do to help this other person feel better? And they're less likely to be prioritizing themselves. And I see this pattern a lot with high-risk HPV. Women are often taking care of everyone else and putting themselves way down on their to-do list. So a lot of what I do in the protocol, where I help women to eliminate HPV, get rid of it and get it to negative, is I teach them how to prioritize themselves. Now, how to take care of themselves helps them then take care of others because they feel better, right? So we have to learn how to, even if we're very perceptive of how others are doing and how others feel, we can learn how to put the focus on ourselves and prioritize our own health. Also, women who are highly sensitive are more likely to find themselves in a toxic relationship because they are so caring and giving and nurturing. So they might be taking care of someone who's actually being abusive and hard on them. Women who are highly sensitive are also more likely to be judgmental of themselves. So when they find out that they're testing positive for high-risk HPV, they're more likely to really be hard on themselves, criticize themselves, and feel ashamed and embarrassed, and find that they don't even want to tell anyone, and may find this even hard to ask for help. So if that's you, if you're finding really like your mind is really being hard on yourself, some women have said to me they feel disgusted with themselves, or they're recoiling from themselves, and they don't even know where to go from there or who to talk to about it. That's very common for women who are testing positive for high-risk HPV because it is a sexually transmitted virus, and there's still a stigma around sex, and there's a stigma around a virus like HPV, and I believe that should be completely eliminated. When it comes down to it, we're all human. All humans have sex, and 80% of humans get exposed to HPV virus. So this is not something that means anything bad about you. You didn't do anything wrong. It's simply that you got exposed to a virus, and what can happen is we tend to want to think about the other person, who exposed us, when did they expose us, and our mind can go in spirals and loops, worrying, trying to figure it out. And ultimately, we can't go back in time to prevent the exposure, and there's no way in the testing to know who exposed you, when they exposed you, any of that. All we know from the testing is whether you're testing positive or not, and we can't tell you from whom or when. I know how scary it is to test positive for HPV virus, and I know it's even more concerning when your gynecologist tells you that all you can do is wait and see if it continues and if it causes abnormal cells. That's exactly why, as a naturopathic doctor and midwife, that I feel so passionate about helping women to be proactive about protecting themselves from HPV virus. I've been helping thousands of women for the past 23 years to do exactly that and to get HPV to negative and stay negative. And that's why I developed the Say Goodbye to HPV online program, where you can get access to my proven protocol from wherever you are in the world. So I hope you will come check out the Say Goodbye to HPV program, review the success cases, and see if this is going to be a good fit to help you get your life back from HPV. So what I encourage you to do is try to let go of those worries. Try to say to your mind, we're not going to know who or when or how. We're not going to know. We just know it's there. And what that means is it's time to take your health into your own hands. It's time for you to become your own best health advocate. It's time for you to prioritize you, for you to teach your mind and body that, yes, while you're able to perceive your environment and you're able to perceive what's going on with others, we need to learn how to keep the focus on you and protecting you. Because what happens is when we tend to be more giving and highly sensitive, we're being opening and welcoming to everybody. And when we're opening and welcoming to everything all the time, that's when the virus walks in. So we need to learn how to protect ourselves. What can you do to prioritize you, your health, your life, your body, your future? Because ultimately, that's what's most important. And the other person, they can take care of themselves, because a lot of times women will say, well, what if I expose my partner? Do I need to take care of my partner? And I encourage you to say, let your partner decide for themselves about their body. If they want help, they can get help. But what's important for you is to focus on you, focus on your future, your health, your body, because you're the best one to take care of you. Ultimately, we each are here to take care of our own body, as well as our mind and our spirit. And so I encourage you to use this opportunity to put the focus back on you and to get curious. What is my body? All these sensitivity messages that my body's giving me, what is it trying to tell me? And I sat one day in the middle of a migraine on the bathroom floor, and I asked myself that question: what is my body trying to tell me? And my body, at that time, I got the message that my body was saying, listen, if you don't start listening to me each day and taking care of me each day, giving me chances to recover along the way, then I'm going to have a migraine in order to have time to myself, time in a quiet room by myself. That was because I wasn't taking good care of myself. And it finally made sense to me. I would much rather make time for myself each and every day to recover from the stresses I'm being exposed to, and to detoxify and to rest and to heal, so that I could feel good instead of having to go get sick in order to have time for myself. Does that make sense? So what message, I ask you, what message is your body trying to give to you? What message, in the moment of all the symptoms that you experience as a highly sensitive person, ask your body, what is the message? What does your body want you to know? And with this HPV testing positive, what is it that your body wants you to know? In what way is your body trying to say to you, please, I need more care for me? Maybe it's dietary changes. And I have more videos about dietary changes you can make to help fend off HPV. Maybe it's more sleep. Maybe it's nutrients. Maybe you have some nutrient deficiencies or hormone imbalances. Maybe there's something else going on. Maybe there's an emotion that needs to be processed. Maybe there's some chemicals, toxins that are overwhelming your system. We just need to start asking why. What is it that's draining your system? If you think about it, it's the analogy of a bucket, right? If a bucket has holes in it, no matter how much water we keep putting in, the bucket's going to be empty because it's going out the holes in the bucket, right? So no matter how much we just keep trying to pour into the bucket. Yes, we can support your immune system. We can do things to help fill the bucket. But if we don't address the holes in the bucket, we're not getting very far, are we? So we need to ask ourselves, what's depleting your immune system? What's depleting your body overall? What are the messages that your body's trying to give you through the high sensitivity? And then address those things. Now, when you are a person who's highly sensitive, and again, I've been there, I understand, it means that when someone else could just take a multivitamin might make you feel sick. So as a highly sensitive person, often we're not able to just jump in with the same treatment protocol that someone who's not sensitive can follow. We're going to need to take it slow. And this is something that I am well accustomed to, again, because I had to do it for my own healing process. And I see many patients who are highly sensitive in my practice. So what we do instead is we take it slow. We take it one ingredient at a time. We open capsules and start with tiny doses. And we prioritize based on your case. What's the most important thing to do first? What's the most important thing to do next? How do you feel? How does your body respond? Do we need to modify the dose before we add the next thing? So we're constantly listening to your body's signals, honoring your body's messages, and starting off very slow and carefully so that we don't miss a signal from your body. And by doing that, we can start to get momentum in the direction of healing. And little by little, we can address all the holes in the bucket, so to speak, anything that's been depleting you and preventing you from healing. We can address all of those factors. And in the end, we can clear HPV to negative, make sure it does not come back again, and make sure that it cannot cause cancer in your body. So if this sounds like you and you're needing help with this, I encourage you to reach out to me. You can just go right to my website at drdonnie.com, where you can find information about how you can become a one-on-one patient of mine. I also guide group online programs to help with HPV, so that's an option as well. So you can also just go straight to clearhpvnow.com to learn more and to see all of the resources that I have for you, to know that it's possible. It's absolutely possible to get HPV to negative. You'll see all the testimonials on my website to encourage you to know that it's possible for you too. Even if you feel like, how can I ever do this? I'm so sensitive to everything, and you're feeling doubtful and judgmental of yourself. How could this? It feels like everything works for everyone else and not you. I'm here to tell you it can work for you too. I've seen every different scenario, all different ages, all different lengths of time of dealing with HPV, women who've been struggling with this for more than 15 years, even over age 50, and it's possible. It's absolutely possible. So I hope you feel encouraged, and hope you know that it can be implemented and customized to you and your body, and actually learning to listen to your body is part of the healing process. That learning to listen with your body and work with your body and make friends with your body and make friends with the nutrients and herbs so that they can benefit you, that's part of the healing process. And it's so worth it. So if you're listening in and you're needing help, I welcome you to reach out. I'm here to help you, and I look forward to hearing from you. And thanks everyone for joining into this video. And make sure you subscribe so you don't miss the next one. I'll see you soon.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdonnie.com.